Hello friends, welcome back. If this is your first time, my name is Sergeant Perez. I am an Army medical recruiter. In today's video, I'll be talking about the AMEDD Enlisted Commissioning Program, or AECP. Let's get into this. So before we begin, a couple things that I want you to keep in mind. Number one, research if this program is for you. You do not want to get into something that later you regret. Talk to your family and friends. That's going to be also important because you will need their support. Also note that this information can change at any time. At the current time of recording this video, it is March of 2025. So each year, a couple things are going to change. Use this video as your starting point, as your foundation, and then you go from there. All the examples, templates that I present in this video are being redacted and is only for information purposes. And one last thing, stay all the way to the end for something special. Definitely you do not want to miss this. Okay, so this video is going to be divided in 3 sections of the application process. What is AECP? In this section, we're going to find out if this program is for you, the soldier and the school requirements, where I'm going to break it down, all the things that you're going to need to be able to qualify, and lastly, the AECP packet itself. In this section, I explain all the things that are necessary for completing your packet when you're going to be working with the recruiter. So what is AECP? AECP stands for AMEDD Enlisted Commissioning Program. It's a program dedicated for enlisted soldiers in the Army that help them to finish their bachelor's degree in nursing, and then they will be commissioning in the Army Nurse Corps. A couple things to keep in mind. You need to pass the license, which is the NCLEX, and also you will have to serve 4 additional years as an Army nurse. It's very important that you read the MIL message 24-475, which is the AECP MIL message, and also the guidelines. You need to identify national accredited Bachelor of Science in nursing programs within the United States. And also have your transcript evaluated by the academic advisor for that particular nursing program. If you need to use your tuition assistant to be able to complete your prereqs to apply for that nursing program, so you can reach your education specialist at the education center, and they can help you to complete the memorandum for record to request more assistance. Now let's move on to soldier and school requirements. So who can apply for this program? It could be enlisted soldiers of the rank of E4 promotable and above, and they need to be MOS qualified, have completed basic leadership course, have at least 4 years but no more than 12 years of active federal time, and approved conditional release. I'll be discussing more about the conditional release later in this video. Have a minimum of a 3.0 GPA as calculated from all college level courses. You need to be 37.5 years old by the time when you begin your nursing program. Have a GT score of 110 or more, pass a commissioning physical, met the height and weight standards, and be able to obtain and maintain a secret clearance or higher. The nursing program that you want to apply, they need to have the following requirements. Within the last 3 years, they need to have a 90% of higher of NCLEX pass rate students. The nursing program needs to be accredited by the ACEN or the CCNE. You must complete the program within 24 months, and also accelerated programs are recommended. Be within 100 miles from the closest military treatment facility, or MTF. Offer in-state tuition, and this tuition cannot go above $15,000. The program must begin between the month of May to September. Winter and spring semesters are not acceptable. In here, you will see a list of preferred colleges. These colleges have worked before with AECP students, and also they're vetted by the Army Nurse Corps. It is recommended that you as an applicant, you apply to more than 1 college. The school will be able to write you an unconditional letter of acceptance. This letter needs to include the following: the projected start and graduation dates in 2-digit format for month, date, and year. The projected yearly tuition and fees. What is the first time NCLEX pass rate for the last 3 years? You as a student, you cannot take more than 1 class online, and this class cannot be associated to clinical or laboratory. The university must be within 100 miles from the military treatment facility. In the letter, it has to say if it's a conditional or unconditional letter of acceptance. If the letter is conditional, then it must say how many classes are you missing. They need to have the calculated GPA. And you as a student, you cannot use your tuition assistant or GI Bill or any other scholarship, grants, or loans to pay for your education. The Army will pay 100% of your tuition. Lastly, the school must acknowledge that your letter is an acceptance letter. And here is an example of an unconditional letter of acceptance. You can pause the video so you can take a deeper look. The AECP Packet. In this section, we're going to be discussing the items that you will need to work with your recruiter to complete your packet. There is 3 main things that have to be completed: your physical, your CV packet, and also your scroll. Before I continue, there are some deadlines that you need to keep in mind. Number 1, your CV packet is due on August 1st of this year. The AECP packet is due on August 21st of this year. Now let's make that a little bit clear this. That is the last day your recruiter has to submit your application or packet to Fort Knox. So you do not want to wait until the last minute to get this submitted. And the board will convene between the 8th and 11th of September of this year. Let's talk about the commissioning physical. Inside the physical, there's 3 main things that have to be completed: the commissioning labs, the commissioning hearing, and also the physical. When you go and you talk to your provider that you want to have a commissioning physical, your provider should be able to schedule you for these 3 things. You do not need to be fasting for the labs. If you're 40 and over, then you need to be fasting when you go for the labs. The hearing exam is the same as the one that you do every year. And the commission physical is similar to the MEPS physical. If you wear glasses, make sure that you bring your eyeglasses and also your paper prescription. You will have an eye exam that day. For applicants who are 40 and over, you need to let know your provider. They need to get you scheduled for additional tests. And these are, like I said before, you need to be fasting for your labs. You will need an EKG and also some x-rays. Make sure that you get this done before the day of your physical. If you are in the Army Reserve or National Guard, you need to talk to your recruiter because potentially he or she will have to get you scheduled to go to MEPS to take the commissioning physical. Here are the things that you need if you need a medical waiver. You must obtain a clearance letter from your provider. The letter has to be written in an Army format. Inside the letter, they need to be stating every single condition that you have that are disqualified. Within each disqualification, they need to write the description, the treatment, and future outcome. And if you're clear for duty. If you're an Army Reserve or National Guard soldier, you need to obtain this letter from your civilian medical provider. This right here is an example of a military clearance letter. I highlight some areas that are very important for the letter to have. At the end of each disqualification, it needs to say if a waiver is recommended according to the duty. After listing all the disqualification, the last paragraph must state that you are in good fit for duty and that are recommending the waivers. Lastly, also they need to add the point of contact of your provider and also the signature. The doctor who signs need to be either a physician or a nurse practitioner. And here is an example of a civilian clearance letter. I highlight the area of emphasis. In this scenario, you can see the condition, the assessment, and the plan. And at the very end, it's also signed by a physician. As part of your CV packet, here's the list of items that you will need to be working with your recruiter to get your CV packet completed. Here's an example of how a CV should look like, but also you can find an example in the AECP website. For active duty soldiers, when you initiate a conditional release, you use your IPSA application and you submit a personal action request or PAR. As soon as your company commander signs on the PAR request, make sure that you take a screenshot and send that to your recruiter. After your conditional release is being signed by your branch manager, you will receive a personal action request form. It will look like this, where you will see every single person who signed and approved your conditional release. You need to make sure that you provide the conditional release and also this memo to your recruiter. For Army Reserve and National Guard soldiers, you need to submit a DD-368. You can complete this with your recruiter. Your conditional release has to go all the way to the first star general in your chain of command. The general should complete block 5 and 6, and you will receive back your conditional release signed and approved with a specific date of expiration. In some cases, also you're going to receive a memo of a delegation of authority. That is completely fine. Just make sure that you provide these 2 documents to your Army recruiter. For your STP, you need to make sure that your S1 are the one who certify it. This could be the NCOIC or the OIC. In the second page of your STP, you need to make sure that your GT is clearly stated and also highlighted. It's recommended that you have a DA 705 or PT card within 6 months of the board date. This is going to show to the board members that you're still in physically fit condition and that you can pass your ACFT. One more thing, make sure that you do your best to score 90 points in each event. Also, your first sergeant or company commander has to verify and certify your PT card. In here on the left, you have the EMILPO verification memorandum. And on the right, you have the security clearance verification. These two documents are very important as part of your CP packet. Your statement of motivation and intent. This is your opportunity to address yourself to the board members. In here, you can provide information not contained elsewhere in your packet. It should be 1 page long, following the Army writing format, a statement expressing the role of a registered nurse. Make sure that you address between 2 and 3 Army values that you identify yourself. And before you giving this statement of motivation to your recruiter, make sure that another officers read it. For your letter of recommendations, you need to at least obtain minimum 3, your supervisor, company commander, and the chief nursing officer or deputy nursing officer. You have the option to add 2 additional, which is highly encouraged and recommended. Make sure that you provide to your recruiter with the following documents: birth certificate or naturalization certificate, social security card, official transcripts, your CV or resume, licenses or certifications, and DD-214 or DD-215 or NGV-22 if you have any of those, your STP showing your GT score, and the conditional release, approved or initiated. Now let's talk about a little couple of things that I highly encourage and recommend to the soldiers. Tips to be a competitive applicant. Your GPA is going to be very important. Can you get your GPA to 3.2 or 3.5 or 3.9? The higher your GPA, the better chances you have to be selected. Previous conferred degrees, if you have a degree in sciences, which are a little bit more aligned to nursing, are going to be much better compared to someone who has a bachelor's or some education in, for example, computers. Any licenses or certifications that you have, for example, ENT or BLS, are great licenses to have when you're submitting your application. The more that you have, the better. Unconditional letter of acceptance versus conditional letter of acceptance. It's highly recommended that you have an unconditional letter of acceptance versus a conditional one. Be accepted into more than one nursing school. Your letter of recommendations are going to be a key factor. The board members only have a couple minutes just to know if they actually will select you or not. The letter of intent or statement of motivation. So make sure that after you complete your statement of motivation, that you give it to your supervisor, your company commander, your platoon leader, to as many people so they can review it. You want to have a crisp statement of motivation. Your CV or resume. In here, I will highly encourage that you follow the Army format that is presented in the examples. You want to showcase your skills and to present to the board members that you are an excellent candidate based on your past experiences. Your ACFT. I guess this is very simple. Just make sure that you score 90 points or more in each event. If you can't, just make sure that you train or ask for help. Any problems in the past potentially will hinder your application. Any moral, legal, convictions, UCMJ, any of these issues will affect your application. So make sure that you don't get into anything of this. Your STP, make sure that you talk to your S1 or you have an appointment with your S1 so you can fix your STP. It's going to be very important that you have your STP crisp and nice. Resources. Here is a list of different things that could help you to improve and also do a little more research for your AECP packet. If you need to find an AMEDD recruiter, you can download the Medical Careers app in the Apple or Google Play Store, and on the lower right side you will find Contact Us. In there you will be able to find every single medical recruiting station in the United States. The meal per message, the AECP website, and also the AECP guidelines are another great resource of information. The Medical Recruiting Brigade website, inside there you will find the nursing section where you will find more details and more information about the AECP. Another great place where you can find tons of information is the AECP Facebook group. Also, you could use Reddit in the Army subreddit. If you have access to the military treatment facility, then I highly encourage that you try to find an AECP Army nurse. It's just as simple as you walk into the clinic and ask the NCOIC who of the nurses are AECP. And then you ask for a one-to-one meeting, conversation, a coffee, so in that way you can pick their brain and learn something about. If you have further questions, also you can send an email to the AECP mailbox. And lastly, my YouTube channel. In there, I post resources and information about different AMEDD programs and also things that can help you to improve your application. If you have made it all the way to here, I want to say thank you very much. If you have any questions, concerns, or doubts, make sure that you write them down in the comments. I will make sure to answer those questions as soon as possible. Finally, make sure that also you give a like, share, and subscribe to my channel. This helps soldiers like you and also students to find my information, my resources, so they can become more educated in the AMEDD programs. If you want to know more about other AMEDD programs, click in the video above for my previous video and click in the link below for my next video. Once again, thank you very much, and I will see you in the next one.